Go to the other big news coming to us from the United States this morning, and that is that country's Supreme Court has upheld President Barack Obama's historic healthcare reforms.
It's ruled the president's policy to extend health insurance to around 32 million Americans is constitutional. Barack Obama says it's a historic step for the country.
The highest court in the land has now spoken. We will continue to implement this law, and we'll work together to improve on it where we can. But what we won't do, what the country can't afford to do, is refight the political battles of 2 years ago or go back to the way things were. And now's the time to keep our focus on the most urgent challenge of our time, putting people back to work, paying down our debt, and building an economy where people can have confidence that if they work hard, they can get ahead. I'm as confident as ever that when we look back 5 years from now, or 10 years from now, or 20 years from now, we'll be better off because we had the courage to pass this law and keep moving forward.
Barack Obama speaking in the White House overnight. Now, of course, that is a very big win for the 32 million Americans that he is seeking to extend healthcare to. It's also, let's not forget, a huge political victory for the president, 4 months away from what is shaping up to be a pretty tight presidential election.
And especially given that this was one of his key policies when he became president, was this plan of universal healthcare. It's so interesting as Australians, where we have universal healthcare, to think that there could be such opposing views to people having health insurance.
50 million Americans don't have health insurance. It's also going to be very interesting to see how Mitt Romney, Barack Obama's political opponent, deals with this, given that a lot of President Obama's healthcare plan was based on what he did as the governor of Massachusetts some years ago.
And of course, he's already said that he will repeal the legislation if he becomes president. Well, to explain the legal controversy over what's been dubbed Obamacare, we're joined by Professor David Weisbrot from the US Studies Centre at the University of Sydney. Good morning. Thanks for your time. Just explain why this ruling is so significant.
Well, it may be the U.S. Supreme Court's most significant ruling since Bush v. Gore, and for some of the same reasons. It's a highly, highly political case, and it comes right on the eve of the presidential election. So it really is shaping the political discourse in America for the next bit of time. It's also in its own area. It's very important because the U.S. has a very chaotic, expensive, and inefficient public health system. And this is a really good attempt. It wouldn't be my perfect design, but I think it's a really good attempt to try to address some of the major problems in American health care.
And how significant was it that one of the conservative judges voted with the more liberal judges on the bench?
Very significant. There were a lot of different scenarios. I think the Democrats' probably most optimistic scenario was that Justice Anthony Kennedy, who's the normal swing judge, would join the four more liberal judges on the court and get a 5-4 majority that way. Having Chief Justice Roberts do it is, I think, much more powerful. It indicates that even quite conservative judges are willing to accept the merit of the Obama administration's arguments in this area. And I think it's important for the court as well. There's been a deepening cynicism in the United States for some years now that it is a political court rather than a judicial court, and that the members are voting purely according to their political allegiances. And I think Roberts was stung by that. I'm not saying that necessarily affected his decision here, but I think that he would probably be pleased that there was a bipartisan consensus, or at least a bipartisan majority in this case.
And let's just talk about this decision in the context of the elections, which are due in just a few months' time. How significant a win is it for the Democrats and for President Obama?
It's very big, and I think it would have been crushing if he lost. After all, health care has been the centerpiece of his first term as president. There's a lot of criticism that can be made about jobs creation and other things, but healthcare has been a huge victory for him. It's been 40, 50 years in the making. I remember many presidents over the years have tried to do this. The Clintons famously tried and failed, and Obama succeeded. So I think it would have been very bad for him if he lost. On the other hand, the Republicans have a rallying cry. I suppose they'll campaign heavily on it, although it takes a lot of chutzpah to do that, given that Mitt Romney actually put in almost the identical law in Massachusetts, and for many years cited that as the crowning achievement of his governorship in Massachusetts. So for them to retreat now is very strange.
And yet his response to this has been really quite visceral. He says that it was bad law yesterday, it's bad law today, and it's a job killer.
But apparently it wasn't bad law when he was governor of Massachusetts. It's hard to see how it would be a job killer. It actually makes it easier for businesses to be covered. It provides a lot of new money. There are 30 to 50 million Americans who are not covered by health insurance. And it's shocking in Australia, where everyone is covered in our quite good comprehensive system, and most people have private insurance as well. But in the U.S., that's not the case. Also, there are so many horror stories of people who have chronic conditions or pre-existing conditions who are denied health care, or even they've been paying for health care, and then the company, the insurer, pulls it off them when they get some more serious condition. So I think it's very important. Also, the U.S. spends twice as much money as Australia. It's about 18% of GDP compared to 9% in Australia on health care. So they're spending an enormous amount of money that could be rerouted to much more productive use. And one of the features of the Obamacare legislation is that the insurers have to spend at least 80% of the premiums that they receive on health care. They can only take 20% for administration and profits. And in fact, if they don't spend the 80%, then they have to rebate those funds to either employers or individuals, depending on who paid the premium.
The Democrats, including the president, have said that now that this matter's settled, they need to move on to other matters like jobs and the economy. Does that bode well for them in terms of the election campaign?
I think so, and I think when it's explained better, it will also be more popular. Most of the polls for some years now have showed that the Obamacare legislation is not popular. A plurality, at least, don't like it. But then when you go into all the individual things that I've mentioned so far, people love it. So I think they've done a poor job of selling that legislation. It has resonances with Australian politics. And I think during the campaign they'll be much more focused on that achievement. But really, it's in American politics, it's the economy, stupid. So if the economy improves, if employment improves, Obama, I think, is a shoo-in. If the economy is poor and if jobs don't increase as we move into November, then I think he's got a struggle on his hands.
Okay, we'll watch with interest. Professor David Weisbrot, thanks for your time.
Pleasure.